Alright, so in this recording we're going to talk about the gastrointestinal system, a little bit of anatomy and physiology review. We have ingestion and digestion of food, absorption of nutrients, and elimination of waste. So we ingest through our mouth, and then our pharynx, which is connected to the esophagus, is going to start the digestion process. Well, actually, we're going to start the digestion process in the mouth because we have salivary glands, and those salivary glands are going to release some stimulation, letting the stomach know that food's on its way. So it goes into the pharynx and the esophagus, which goes down into our stomach. The stomach, we have our pancreas and our gallbladder, which are accessory organs, and they're releasing chyme and helping with the digestive process in the stomach. Then the food particles will travel to the small intestines, where they are going to reabsorb, and like the small intestines and large intestines are going to reabsorb nutrients into the body as well as water, and then the waste comes out via the rectum. And remember that we also have accessory organs that help with this digestive process: our salivary glands, liver, gallbladder, and our pancreas. The pancreas will help to release insulin. The liver stimulates the production of glucose by gluconeogenesis, which will tell our pancreas that insulin needs to be released. The salivary glands release stimulation into the mouth, which tells our stomach food's on its way. And then we have gallbladder, which helps to emulsify our fat. So this is just a little picture of the digestive system. It has everything that I just talked about, so I'm not going to waste time talking about it again. Then we have significance of pain by quadrant. So in our right upper quadrant, remember our heart sits, Alright, so remember that our heart sits like in the lower middle part of our chest. So we could possibly have heart pain in our right and left upper quadrant. Our lungs can be indicative of having a PE or pneumonia, and that's in the right and left upper quadrant as well, the lower portions of the lungs. The right upper quadrant houses the gallbladder, so you could have gallstones or gallbladder attack. It also houses our liver, so it could be a sign of hepatitis or cancer. And our intestines are in our right upper quadrant, which can be indicative of a duodenal ulcer. The left upper, we already talked about heart and lungs, but it also has our pancreas. So if you have pancreatitis, and it has our spleen, which is, if it's ruptured, you could have pain. And then our stomach, which can be indicative of gastric ulcer, esophagitis, GERD, hiatal hernia, or varices. In the right lower quadrant, if you're a woman, your ovary and your uterus are in the right lower quadrant. So you could have ectopic pregnancy, ovarian cyst, or pelvic inflammatory disease. Again, your intestines are also in the right lower quadrant, so there could be perforation, obstruction, constipation, Crohn's disease, diverticulitis, hernia, and ulcerative colitis. The right lower quadrant has the appendix, so you could have appendicitis. Rebound tenderness is very big with appendicitis, so if you push in on the right lower quadrant, or actually if you push in on the left lower quadrant and you push out, the pain will intensify on the right lower side, and the pain is worse going out than going in. We have our kidney, or right kidney, on the right lower side, obviously. So you could have kidney stones or infection, CVA tenderness. In the left lower quadrant, you have your ovary and uterus, if you're a female. So it could also be ectopic pregnancy, ovarian cyst, or pelvic inflammatory disease. Again, your intestines, which basically is everything I already said as far as that goes: constipation, diverticulitis, hernia, ulcerative colitis, and your left kidney, which could be kidney stones or infection. Oops. So how does the GI interact with other systems? With our integumentary and our musculoskeletal, it protects and supports our digestive system, and it assists with eating, chewing, swallowing, and defecation. The musculoskeletal helps with peristalsis, which is what that means, eating, chewing, swallowing, and defecation. That's how it helps. And then integumentary, it protects and supports our digestive system, so it basically keeps everything housed inside so that we don't have any issues. Our respiratory and our cardiovascular system help to provide oxygen to the gastrointestinal organs so that the digestive system will function. So inadequate oxygen can lead to ischemia. So somebody could have bowel ischemia because they don't have an adequate oxygen supply. The neurological system releases acetylcholine, which will help secrete digestive juices, and it increases peristalsis. And then it also releases norepinephrine, which basically does the opposite, so it produces a decrease in peristalsis and digestive juices. Then there is the endocrine system, which helps to release insulin, glucagon, and gastrin into our bloodstream, which helps aid in carbohydrate metabolism. And it secretes bicarbonate and pancreatic enzymes into our duodenum to aid in digestion of fats, proteins, and carbs. So some developmental variations. In our infants, they have abdominal protrusion. Their bladder is above the symphysis pubis instead of resting inside it, and their liver takes up more area. With children, they have a relatively larger abdomen than those of adults. Their abdomen is more prominent and noticeable in toddlers and preschoolers, and they will also, like, abdominal respirations is normal in a child, whereas if an adult is doing abdominal respirations, they are in distress. When a woman is pregnant, there's a lot that goes on with her GI. Her abdominal muscles relax, so her uterus may protrude. A woman could have a separation of abdominal muscles. This is more prevalent in multiple pregnancies. Their bowel sounds are going to be diminished because everything is displaced because the uterus is so large. The woman will be constipated because everything is slowing down. Their appendix is going to be displaced, which can make the diagnosis of appendicitis difficult. So in the normal GI, the appendix is in the right lower quadrant, like close to the ovary. And in a pregnant woman, the appendix is actually going to be upward and lateral. I think it's still in the right lower quadrant, but it's higher in the right lower quadrant. A pregnant woman can have linea nigra, which is like basically that discoloration line from the umbilicus below. They could have striae, and their belly button could be possibly everted. It's their little timer. When it everts, it's time to have the baby. In the elderly, their dentition will change, which means that they might not be able to eat as well, which can cause some nutritional issues. Their dentures could be poorly fitted because dentures are expensive. Saliva is reduced, and because saliva is reduced, they're going to have a decreased sensation to eat. Motility is reduced, which can increase their risk of constipation. They can have a reduction in stomach acid. These are whenever they have these problems with swallowing, absorption, and digestion because of these things. Also, they're going to have increased constipation risk due to everything that I stated above, as well as having a reduction of muscle mass and tone. Their liver is smaller and it doesn't function as well, so they can't metabolize medicines as well, so they are at an increased risk of toxicity. And as you know, many geriatrics are on many medicines. And then as the person ages, the accumulation around their waist, they have fat that accumulates around the waist or lower abdomen. So subjective data, so appetite, dysphagia, intolerance to food, abdominal pain, nausea, vomiting. abdominal history, bowel habits, medicine. So questions that we should ask. Does the patient have any current stomach issues, any abdominal pain? Don't forget your old cart, onset, location, duration, characteristics, aggravating and relieving factors, and any treatment. Are they constipated? Are they having diarrhea? Diarrhea is not just one loose watery stool, it is 3 loose watery stools in a 24-hour period. So make sure that the patient specifies how many loose watery stools they're having. Are their bowel habits normal? What is normal for them? What does their stool look like? Because different types of characteristics of stool can tell us different things. Like if they have steatorrhea, which is their stool is like fatty and floaty, maybe their gallbladder isn't working as effectively. Is the patient having any nausea or vomiting? Are they intolerant to food? Are they excessively gassy? Is there any change to their appetite? Any change to their weight? Reflux issues, heartburn issues. Again, like with a lot of people, they think they're especially the female gender, they think they're having reflux issues when in actuality they're having heart issues. So that needs to be clarified. Need to make sure that it is more gastrointestinal and not to dismiss that is not heart. Also, a lot of women will actually have referred gallbladder pain, and it might not be where the gallbladder sits. So again, they present differently, so it needs to be investigated. How often does the person urinate? What are the characteristics of their urine? Coca, color, odor, consistency, aroma. Does it smell? Do they have any urinary incontinence? What does their urine look like? How much do they drink in a typical day? What do they drink? If they're drinking caffeine or alcohol, it's going to dehydrate them, and they may not urinate as much, so they need education on that. What is a typical meal for them? Do they have sickle cell anemia, Crohn's, or IBS? All these things can cause abdominal issues. So organs of your gastrointestinal, you also need to ask if they're having any specific issues with them. So if they're having issues with their gallbladder, which again is in the right upper quadrant, the pancreas, which is in the left upper, the liver, which is in the right upper, and your kidneys, which are in the right and left lower, and the bladder, which is kind of in the right lower. All those things need to be assessed as well. What specific risk factors do they have? So if they smoke or drink alcohol or any recreational substances, they can increase the risk of certain disease processes. Any family history of gastrointestinal issues or colon cancer. So for our assessment, we're going to ensure that we have adequate lighting, and we're going to expose our abdomen so that's fully visible. We're going to drape the genitals and the chest, especially if they're a woman. But you don't want to like let them get cold. Like even if it's a man, you don't want them to be exposed because they're going to be cold if it's a cold room that you're doing the assessment in. So make sure that you provide modesty, provide privacy, and keep them, adequately covered, regardless of whether or not they're a woman or a man. Measures to enhance the abdominal wall relaxation. Make sure that they have emptied their bladder, because if they have not emptied their bladder, they're not going to relax. You want to keep your room warm so that they don't get chilled and don't tense their muscles. Position them supine with their head on a pillow or their knees bent, or on a pillow, and their arms at the sides or across their chest. You want to discourage them from placing their arms over their head, because that tenses the abdominal musculature, and you want the abs to be in a resting state. You want to make sure your hands and your stethoscope are warm, and you want to make sure there's no distraction. So you're going to inspect the abdomen, so you're looking for your size, shape, and your symmetry. There's different abdominal types there. You have rounded, scaphoid, protuberant, and flat. Flat is usually what we want. but you know, a lot of people have rounded abdomens these days. We are going to stoop, sit, so that we can gaze across the abdomen, and then determine the profile from the rib margin to the pubic bone and the contour so that it will describe the nutritional state. That's why we're looking at that, to see what their nutritional state is. And I already talked about the types. Then we're going to auscultate, because you want to auscultate the abdomen before you palpate. So you're going to hold the stethoscope lightly against the skin, because pushing too hard could stimulate more bowel sounds. You want to begin in the right lower quadrant, because bowel sounds generally are always present there. When you listen for bowel sounds, you want to note the character and the frequency. If they haven't eaten yet, they actually might have a lot of bowel sounds because their belly is hungry. If they just ate, they might not have as many bowel sounds because what they ate hasn't gotten to their intestines yet. Bowel sounds tend to be high-pitched and gurgling, and they can be anywhere from 5 to 30 times per minute. If they are more than 30 times a minute, then they're considered hyperactive. If they're less than 5, they're hypoactive. Anything that if you ever document absent bowel sounds, you have to listen for 5 minutes in each quadrant to say that it's absent. I have never, ever had an absent bowel sound. Curious if anybody else has. As you listen to the abdomen, you also want to note the presence for vascular sounds of bruit. So remember, your renal artery and your iliac artery are in, and then you have your abdominal aorta, so you need to listen to all that to make sure there's no bruit. You want to check over the aorta, the renal artery, iliac, and femoral arteries, just to ensure that they don't have any bruits. And if they do, that is not good, and you should let somebody know. So percussing, you want to assess the density, locate your organs, and screen for abnormal fluid or masses. Going to admit that I do not percuss the abdomen. Unless there is a specific reason to percuss the abdomen. I don't normally percuss the abdomen. I think it's more of a advanced technique. But if you do, it should be tympanic sounding. So you're going to percuss lightly in all 4 quadrants and move clockwise. Then we're going to palpate. With light palpation, it's less than 1 centimeter, and with deep, it's 4 to 5 centimeters. You want to lift your fingers, not drag them over the abdomen. And while you're palpating, you want to note the temperature, turgor, the texture of the abdomen, the thickness, and their hydration status. Screen for any abnormal masses or tenderness. So we want to think about the 9 quadrants when we're palpating. In our right hypochondriac region, we have the right lobe of the liver, the gallbladder, the duodenum, the hepatic flexure, the portion of the right kidney, and the suprarenal gland. In the epigastric region, there is the pylorus, the duodenum, the head of the pancreas, the portion of the liver, and the aorta and the renal arteries. In our left hypochondriac region, we have the stomach, part of the stomach, we have part of the spleen, we have the tail of the pancreas, splenic flexure, the upper portion of the left kidney, which you can't really see on this picture because it is behind the intestines, and the suprarenal gland. In our right lumbar, we're going to have the part of the right kidney, the hepatic flexure of our colon, the ascending colon, the duodenum, and the jejunum. And then in our umbilical region, we're going to have the lower jejunum and ileum, and then the aortic and iliac arteries. In our left lumbar, we're going to have our descending colon and our lower half of kidney, the left kidney. In the right iliac, you have your cecum, your appendix, your ilia, your right femoral artery, your right ureter, your right spermatic cord in your male, and your right ovary in your female. You have a lot in that region. The hypogastric region, you're going to have the ileum, bladder, uterus, and the aorta and femoral arteries. And then in your left iliac region, you're going to have your sigmoid, left ureter, left spermatic cord for your male, left ovary for your female, and the left femoral artery. So the abdominal assessment is like your $10 million assessment because there's so many things that can go wrong in there. All right, and if you have any questions, just let me know. Thank you.